Hi everyone. One of the most common questions I get on a weekly basis is what to do in the morning for a stretching or a mobility kind of exercise routine. Again, this is just for people who have general complaints of stiffness, soreness, or are in a little bit of pain. The goal is to take 5 or 10 minutes, do about a handful of stretches just to get your joints moving, your discs feeling like they're more hydrated, and just to get you feeling better when you get up and take those initial steps out of bed. So I'm just going to show you kind of a handful of ones that I generally prescribe. They're pretty gentle, they're pretty easy. Again, these are also more for the people who are in some general pain in the morning, maybe moderate levels, somewhere around there. These are meant to just kind of get your body ready to start moving. And then hopefully, again, those first couple steps, like the walk to the bathroom or just kind of walking to get your coffee, something like that in the morning won't be so painful. And then obviously you can kind of figure out how to change these depending on what you need. So listen to your body is the key, okay guys? So I'll just run through some of these. I'm not going to do all the reps, sets, but I'll certainly put more of a detailed description at the bottom of the video. And then you guys can kind of change them as you need. It's more of a foundation. I'll probably do more of these depending on kind of what you guys want or request. Okay, let's go. So the first one is a pretty simple one. It's generally meant for moving your spine side to side. We call it just a lower trunk rotation. The goal is to get your knees moving in a side to side fashion. You can start pretty small, then you can progress to something more larger like I'm doing. You can't really appreciate it, but my back is fairly extended off the ground. There's a decent amount of space there. I have a little bit more curve in my back. So generally what you want to do is kind of try to take that up a little bit by maybe even putting your fingers down in your back. That kind of tries to engage your abdominal muscles or even your ribs right here. Try to lightly pull your ribs down. From there, if you can maintain that and breathe and then rotate at the same time, we won't get as much extension in our spine, which might feel better in the mornings. But either way is good. You might just have to make some little modifications like that. From there, most of you have seen something like this where it's just bringing your knee up to your chest. All that's doing is getting your hip to flex and flattening your back. From there, it might feel like it's maybe pulling or creating some tension. That's good. That's what we're looking for. If you can keep it up here and breathe for a little bit, maybe 1 to 2 breath cycles, then switch. If you can keep the other one bent like this, that'll keep your back a little bit more flat. And then we'll go each way. You can hold them for 3 seconds. You can hold them for 30 seconds. It just kind of depends on what your body kind of wants. From there, if you can bring your opposite foot over your opposite thigh, and then when you're gently trying to pull to your opposite shoulder to create a stretch in your hip. This is called a piriformis stretch, but you're getting a couple different muscles in there to stretch. Even including your sciatic nerve. You're even probably tractioning or pulling a little bit in your spine, depending on how tight you are too. So it's generally a pretty good stretch to do. There's different modifications as well, which I'll go over in the future. Doing the other side, you're just kind of noting like what side feels tighter, what feels more maybe even a little painful to your back, what tends to send signals down your leg. Depending on that, you'll just vary how intensely you do the stretch or how long you hold it, or are going to be some easy parameters to change. From there, if you want to grab the right behind your knee with your thigh pretty vertical, if you can. From there, you're just moving your knee more in a straight or extended position or a bent or flex position. The goal is just to get your hamstring, even maybe your calf a little bit, to stretch, just to feel like it's loosening up. Especially if we sleep, we bend our knees a lot, kind of in a fetal type position, so that really keeps our knees flexed a lot throughout the night. So now we need to start straightening them out a little bit. If you can get to a certain point there in the knee and hold that there where there's just a mild stretch, and then get that foot to move up and down, or circles or side to side, that just gets a lot of that sciatic nerve to move as well, which as long as it's not that sore or irritable, this can be a good one just to maintain that sciatic mobility. From there, you can hold this longer and do more reps, or if it's a little more stiff or sore or even a little painful, just focus on the knee first, and then you could always go more to the ankle. From there, I'm gonna just lift my shirt a little bit so you can see my low back. So I have a little bit of an increased kind of curve in my low back generally. So to kind of find that, put your fingertips underneath your low back and lightly try just to push the small of your back into your fingers. If you can do that and feel the pressure of your back on your fingers, that generally means you're moving your spine and your pelvis. What we're looking for is your pelvis to kind of move more in a forward or of a backward kind of direction. We call those pelvic tilts. These are good just to kind of get your discs hydrated, get your joints moving, and also just get some awareness on how to move that area or differentiate how to move it as we do more progressions, which I'll talk about in future videos. From there, if you can even do that tilt, push your feet into the ground and then just see, or even try to elongate or pull your knees away. That's going to engage your buns, your hips, and your low back. So again, flattening your back, pushing your feet down, and then trying to push or elongate your knees will then get this long feel, and we call this a bridge. But really, if we do it this way, where we're doing the tilt first, pushing your feet to engage your buns, and then really use your hips, it'll decrease a lot of the pressure in your back. They call it a decompressive bridge. Think about just recoiling your spine down one segment by one, and then as you lift, lifting one segment each, and then recoiling one segment back into the floor. Excuse me. From there, one of my other favorite ones to do is my next favorite one is to then go on our stomachs. If it's okay, we will usually generally roll and see if we can just lay flat. If laying flat is fine and we feel enough of a stretch in our low back, that's good. Some people will even need to put a couple pillows under here depending on if their back's pretty sore or irritable. But right now I'm looking for people who are, can still move pretty good and aren't in that much pain, but can still tolerate some of these positions well. Again, we're just trying to get stiffness, soreness out of the way so we can get up and feel a little bit better. So if we can prop our elbows here, hopefully we feel a little bit of a mild tension or pull in our low back. And the goal is just to breathe, just kind of focus on taking a deep breath in through your nose and then out through the mouth. And just let your back feel like it's sinking into the floor, table, wherever you're doing this. And then the goal is to do it for maybe 5 or 10 breath cycles. If you want to kind of push through your forearms and wrists into the ground to arch your back a little bit more, generally that's a pretty good way to start to get a little extension through our back. I'll do additional progression videos for this as well, especially with people who have disc pain, disc herniations, even sciatic type stuff. So these are just a good amount or a foundation of stretches to do in the morning. And then one of the easiest things is just to get up and move, get up and walk for a little bit, things like that. And generally, hopefully this stuff should help you move a little bit easier. Instead of people feeling sore for 1 to 2 hours in the morning, hopefully it's 5 to 10 minutes, a half an hour, whatever seems to be kind of more of your current state. So if you guys have any more comments or other options you like to do, certainly comment or let me know. And then I can do a bunch of follow-up videos, which I would do for my patients anyways. So I appreciate your time. Leave some comments below, subscribe, like, and I'll do a lot more videos that pertain to what you guys want. That's the goal of this, because this is what I do every day. So have a good rest of your day. Appreciate you guys watching, and I'll see you next time.